Hello?
Aaron.
Hi, Agnes, speaking. Ntabwo ndi kukumva network yawe ntabwo. Ntabwo nyine uri kuvuga bicikagurika kubera network. Okay. Hello, Agnes. Network yawe ntabwo imeze neza zo kuyitunganya. Hello?
Hi, Agnes. How are you?
I'm fine.
Is she Agnes or someone else?
My name is Alan. I'm the moderator.
Aline?
Alan.
Ellen, hi, Ellen.
Hi.
Yes, I'm Noel, the facilitator.
Okay. It's nice to meet you, meet you. So when I was sharing the screen yawe kuri presentation tukareba ko iri gukora bimeze neza.
Hello.
Hello? Hello, Agnes, can you make me the host?
Ellen,
Let me.
you are sharing your screen.
No, I'm not sharing my screen. You can share your screen of the presentation so that you see Nineko really ready. Yeah, because we let other people in. But I think Agnes has to give you rights of sharing. Agnes, can you make us host?
It says host disabled participant screen sharing.
Oh, okay. Let me allow first to share. Let me allow all of you.
Okay.
Then also, Mr. Noel, can you share with me your email? After you do a presentation, nyine hari ukuntu bagenda bandika ibibazo hasi muri chat.
Yes.
Bari no kuganiriramo, so bisaba ko mbyandika ku ruhande kugira ngo tuzisoma later.
So you want me to share my email?
Yeah, so that I make the document and then for that document.
Sure. This is my email address.
the chat. It's not Gmail.
Can you see my screen?
Yes, we can see it. Na Gmail ufite. Birakunda ni sharing still. Hello?
Yes.
harimo sound iri kwiripitinga.
Iyanjye?
Sound yawe irimo iriripitinga bikaza bisigana.
Ubu ngubu se?
Yeah, gutya sava.
Okay. So, Mr.
Yeah,
No.
yeah, you can see it.
Sorry?
Birakunda kuri yaho birakunda.
Okay. Now I'm sharing the document. So. Okay. Mr. Noel, can you share it? Could you know that the feeling of the whole screen? Okay, I'll put it ahead. Okay, yeah. Yes. Okay.
Is it okay now?
Yeah, it's okay.
Yeah, the course is supposed to take 1 hour or 2 hours?
2 hours.
2 hours.
1 hour for presentation and
presentation.
another hour for questions and answer.
Yeah. Were you able to see the document that I shared where we'll be writing questions? The document that I shared where we'll be writing the questions, did you see it? I just shared it.
I'll check it later.
Okay. So also the other thing that we need to look at, will you be reading the question yourself? Questions is somebody chat, Jangwa, I read them for you.
If possible, they may just chat questions, then we may answer directly.
Okay, so niyo mpamvu iriya document nyine tuyikora kugira ngo bari batangamo comments and questions, so we put the questions aside to be easier to identify. So
okay. Ntabwo nari nayibonye niyo nayoboze ngo ndaza gucekinga. Uburyo bwiza bworoshye ni ubuhe?
no ubwo ngubwo nyine bw'iyo document nari ngusharinze kugira ngo nyine nubwo baba bari gucatinga njyewe mba ndi gukuramo questions banditse, wowe ukaza kuzireba kuri document iri shared with you, ukarebaho questions nyine mba nashizeho, then it's easier for you to answer. So
uyohereje kuri mail?
Yeah, email warunyohereje.
Okay, reka nyirebe.
We are about to start. 5 minutes.
Yeah. So I will start with introducing the facilitator and also kubwira abantu guhindura amazina nyine baba bafitemo amazina y'amatelefone, and then Agnes, you help me with muting people.
Yeah, all people will be muted in the interest.
Okay. Yeah, so I think after the introduction, then I will welcome Mr. Noel to take us through.
Thank you.
Agnes,
uzi impamvu byiripitingaga ufite nafunguye na live kuri YouTube.
So you have
impamvu amajwi ari kuza yisubiraho. Ndi kuri machine.
Ufite machine ni wenda na phone. You have two things in.
Yeah, I have two things. Ariko uri co-host kuri machine niva urakomeza hosting, it's okay. Nongere connecting. Okay.
Okay. So Nuta ari bu joining Jedi.
Jedi is very sick. We're not. It's me and you and Emanuela. Emanuela, she's joining now.
Okay. So I think after the session, then turi busezera abantu. Then yeah, I think that's it.
Yeah, icyo turi bukore turababwira ko evaluation ndahita mbaha link yo kuri website niho bari buze gukora evaluation.
Yeah, evaluation ibamo za questions niba umuntu yatendinze for the certificate, right?
Ku bantu batendinze baraza kujya kuri website kurebaho certificate.
Okay.
Yego.
Yes.
Okay.
So Mr. Noel, wayibonye document?
Ndimo kuyifungura. Ndimo kuyifungura ariko nayibonye. Yes. Ndayifite ubu ngubu yafungutse.
Yeah, nabonye ko okay.
Noel, ntabwo uraza kuba uri muted wowe koko waba uzi kuvuga. Rero ndi kumva inyuma hari abana ntibaze gusakuriza cyane.
I close the door.
Okay, good.
Okay.
Okay, I can start admitting people. Huh?
Yeah, so we will start at
it's almost time. Let me admit them. Once they are like more than 50, we can start.
Okay.
They are joining.
Yes, Baba.
Welcome everyone. Thank you for joining. As we are still waiting for a few more people to join, we'll start in a few minutes. So let's wait for people to join and then we'll start right away. Thank you for joining to this session once again. I would like to remind you that we are going to be having this session from 2 p.m. And yeah, so let's first get a few people to join.
Hello everyone, you are all muted on the interest. Still muted. If you want to say anything, please unmute. But if not, please stay muted.
All right. Welcome everyone once again. And my name is Ellen and I'll be your moderator today. So the session today is on occupational safety in the context of COVID-19 for health professionals. We'll be having this session from 2 p.m. to 4 p.m. and facilitator today is Noel Kurukire. This course has 2 CPD credits and yeah, it's on Zoom. If you cannot be able to attend the Zoom because of the capacity, we are also live on YouTube. We are in partnership with different organizations, National Research Foundation, Rwanda Allied Health Professionals Council, and National Pharmacy Council. This course is prepared by Health-Edu. There are a few guidelines that you have to follow for this course to go on. If your name is registered as a phone or any device, please remember to change it to your real names in order to help us be able to identify you. For example, Infinix S5 Lite, please change your name to your real names. Then for purposes of being able to listen to the facilitator and follow, please remember to mute yourself so that we don't cause any confusion and disturbances. And then there will be a link shared after the course whereby you'll go to the Health-Edu platform and be able to answer a few questions in regarding to the course for confirmation of your participation. And then that's when you'll be rewarded certificates. So yes, I think that's it. So before we welcome our facilitator today, I would like to remind everyone to mute so as to follow very well. And I will I will give a brief introduction for our facilitator. Our facilitator is Mr. Noel Kurukire. He's a lecturer at the University of Rwanda, the Department of Environmental Health Sciences, School of Public Health. He has a PhD candidate Carter Fellow. He has been one Health Fellow University Administration Support Program and registered environmental health practitioner. And he's also the chairperson of Rwanda Allied Health Professionals Fund. So please bear with us. We are expectant and are going to learn a lot of things from him. So yeah, I will welcome Mr. Noel to take us through the session. Thank you so much. Before I forget, if you have any questions, any comments, please write them down below in the chat box. At the end of the session, Mr. Noel will be able to answer most of the questions. Thank you so much. Mr. Noel, you're welcome.
Thank you, Aaron. Thank you, participants. First of all, let me put a bit my camera so that you can see my face, but good afternoon to you all. So we are going to start our presentation, our session of today, which is about occupational health and safety for health workers in the context of COVID. I'm going to share the presentation. Is everyone able to see my screen?
Yes, we can see it, Mr. Noel.
Okay, thank you. As Anne said, I'm called Noel Kurukire. I'm a lecturer at the University of Rwanda in the Department of Environmental Sciences, School of Public Health. I'm doing my PhD in public health with specialization in environmental health because my PhD is about exposure to air pollution and associated health effects among school children. So it's about exposure and the effects resulting from that exposure. I have been doing teaching and research, and I have a number of publications in the area of environmental health, public health, occupational health and safety. The recent publication about occupational health and safety was published in 2020 and is about occupational health risk associated with medical waste management in health facilities in Rwanda. So if you type that title or my name in the Google, you may see the publication. It is free. It is accessible. Just you go to Google Scholar and you type my name, you will see the publication. So there are other publications about mental health resulting from exposure to climate change, other publication about the use of ICT in health domain. There are a lot of publications. If you are interested, you can go to Google Scholar, you type my name, you will see the publications. Okay, today is about the occupational health and safety for health workers in the context of COVID-19. So all of us, we know COVID-19. It's not new in our context since 2019. We have been 2020. Sorry, in March, we have been. Mutaganzwa Jean-Claude, can you put off your camera, please? I can see. Okay, let's move on. Since 2020 in March, we heard about COVID-19. The first case has been reported in Kigali, and we know we were obliged to go back home, to stay home until June, if I remember well, went back to our workplace. Then, and recently in January this year, we have been ready to go back at home again. You know, this is the COVID. So now, today I will talk about the occupational health and safety for health workers in the context of that COVID pandemic. Our presentation is going to talk about the introduction, infectious risk to health and safety, prevention of occupational health to healthcare workers, and the role of healthcare workers and managers to limit occupational hazards in the workplace or working environment. At the end of this presentation or this session, participants will be able to describe the common occupational risks to health and safety in the context of COVID pandemic, able to describe different occupational hazards in the context of COVID-19, describe the way healthcare workers may get infection, explain the prevention way of occupational health in the context of COVID, as well as describe the rights of healthcare workers and employers and apply measures for protecting their health and promote the safety. So these are key learning outcomes or learning objectives. So once we finish this session, you should be able to do this, describe the common occupational risk, describe different occupational hazards in the context of COVID, describe how healthcare workers may get infection in this context of COVID pandemic, explain the prevention ways, as well as describe the rights and obligations, of course, of healthcare workers, as well as managers. There we have rights, but also we have obligations. Now, what is occupational health and why is it important? Occupational health and safety is one of the most important aspects of human concern. When you go to literature, it says that each year, worldwide, work-related injuries and diseases kill an estimated 2 million of people in the world. You can see how these injuries or diseases associated with poor working environment may kill or may affect a significant number of people in the world. In the study the study I mentioned before, the study we conducted in the 3 district hospitals in Kigali, we realized that a number of healthcare providers are experiencing injuries and trauma due to poor medical waste management. So if there is poor medical waste management, it means the working environment is not safe. So it may affect negatively the health of care professionals as well as our patients or clients. Again, the literature says that only 5 to 10% of workers in low and middle income countries, and between 20 to 50 of workers in developed countries access to adequate occupational health services, which means you can see if in the low and middle income countries where Rwanda belongs, only 5 to 10% have access to occupational health and occupational health services. You see how it is really problematic. If 95% do not have access to that services, you can imagine how people may be affected. This is why, this explains why these 2 million of people may die or may have injuries or diseases resulting from poor working conditions. So what is occupational health and safety? Occupational health and safety leads to health, safety, and welfare of workers and other people in the workplace. So when we are working in a poor working environment or in poor conditions, we may get disease, we may get hazards, we may be affected. So we have to work in a safe working place or in a safe working environment. So to achieve that, we have to promote the prevention and the control of occupational hazards. So we have to put in place the preventive measures and control measures of the hazard, monitoring the health of workers, as well as promoting health behavior. Because you may see some healthcare workers, even not only healthcare workers, but also other workers in their working place, they are also behaving as they may cause accidents. You may imagine someone, he's not an electrician, but he's just working in electricity. This is an example. So in that case, he may cause accident, or even he may die. Yes, he may die. Or if you are working in the health sector, for instance, in the hospital, but you are not using properly personal protective equipment, you can imagine maybe if you are going to meet with COVID patient, but you don't wear properly the mask, face shield, and so on, you are exposed yourself. So we have to limit occupational hazards. We have to promote healthy behavior. Hello, are you following?
Yes, we are following.
Okay, thank you. Why is occupational health and safety important to health workers or healthcare workers? For the good physical, mental, and social well-being of all healthcare workers, there is a need for health and safety working environment, because health and safety of healthcare workers are very important for quality of care, patient safety, prevention of infection in healthcare facilities. So, in other words, we have healthcare workers should work in a safe environment so they can provide quality of care, they can protect patient, as well as they can protect themselves and their families. There are different common occupational hazards for healthcare workers. We have when we are working in healthcare settings, we may be exposed to biohazards or biological hazards like bacteria. We may find them in the healthcare setting, in the hospital, in the health centers, whatever. We may also find viruses there, the parasite, and those can be transmitted by contact with infected patient. When patient come to health facility to look for treatment or any health advice, he may come with the virus, he may come with bacteria, he may come with parasite. So healthcare workers who deal with that patient or someone else may get infection through different ways that we shall see in the coming slides. Again, in healthcare settings, we may find them chemical hazards. In healthcare settings, we use different chemicals. You can imagine someone who is working in a laboratory scientist or technologist. They use chemicals. These people of anesthesia, they use some anesthetic gases and other chemicals. Not only those, but also different, even those are working in pharmacy. They may have different chemicals. So you can imagine if those chemicals have been expired or not properly being used, so healthcare worker may get he's exposed to those chemicals. People also in healthcare settings may have psychological hazard, for instance, stigma, harassment. Let me come back on this stigma. You know, I have an example. We have an isolation center at my workplace at the University of Rwanda College Medicine or Health Sciences at the Remera campus. But someone who is working in that isolation center, I remember when he goes, okay, recently, when he used to go to the restaurant, but people say, this person is working in the isolation center. Please don't touch on him. You see, this kind of stigma. So it's kind of stigma or kind of harassment in some way or another. But for him, he may feel, okay, it's like you are joking, but to him, it may cause that kind of psychological, psychosocial hazard to him, because when you see, this person is working in isolation, it somehow is not supposed to be with other people. So we need to, so this is another occupational hazard that may occur or which occur in the healthcare setting. Healthcare workers also may be exposed to physical hazards, like, you know, in the context of COVID, you can see these people who are working in isolation centers or who are going to look for those who are infected. You know, they used to have to wear this PPE, personal protective equipments, on the sun like this one. You can imagine how he will feel the heat. So when he goes to the field with these protective equipments on the sun like this, we have, and he will feel like the heat. There is a heat which may cause some other health problems. Also, we may have injection. We may have other accidents. We may have slippery stairs, among others. Those are kind of physical hazards that you may find in healthcare settings. Now, when you look at since the COVID-19 appeared since 2019, end of 2019, this the presence of COVID-19 create access demand of healthcare workers on public health services, and it added, or it worsened the occupational risk to healthcare workers, because before COVID-19, of course, occupational hazards were there. You may find people, when you look at the report from WHO or any other research done in the context of occupational risks before COVID, healthcare workers were experiencing other occupational risks and hazards. But since the COVID came, it worsened the situation, because even when you look at how it is spreading, you may protect yourself from getting unsafe injection, but when it comes to COVID-19, it is really hard to protect yourself, because I used to tell people, when you get HIV, you negotiate it. Sometimes you pay for it, but when just COVID, you may pass by somewhere, you get it. So you see how it is. If you are working in occupational healthcare setting, and there are patients with COVID or any other kind of disease, So the situation has been worsened. So healthcare workers may get COVID or may acquire COVID-19 at work, at home, or even the community, because there are some of healthcare workers, they have to go for tracing those who have been infected. They can go home, they get infection because someone at home is affected, or they may also get infection at their work, in their services. So this is how healthcare workers, they used to be exposed to other occupational hazards and risks, but the COVID-19 worsened the situation or exacerbated the situation, which was there. But now, since the COVID came, the situation became very bad compared to how it was before. There are also chemical hazards, as I said before. This time there is an increase of disinfectant. And those disinfectants may expose the health professionals to chemicals, because those disinfectants are composed by different chemicals. So they may have other risks because of excessive use of those chemicals. Or they may have also risks because improper use of those disinfectants. They may have some skin diseases, or the use of the excessive use of disinfectant may exacerbate or may aggravate the situation. You may have some skin problems, but when you use these chemicals, you may accelerate the level, if I can say, the level or the rate of to have these skin diseases. So this is another way that COVID, the presence of COVID at this time also exacerbate the situation of exposure, especially to these chemicals, because you can imagine how many times you use disinfectant at your workplace. Actually, even people tend to use disinfectant, we call it sanitizers, instead of using water and soap, because some of them told me when you use water and soap, you have we call it umwera. Everyone knows umwera, but they don't think about how they are exposing themselves to these chemicals. So people should be aware of that, either they use it unknowingly or knowingly, but it has a negative impact to health care workers. Other physical hazards, I said before, the prolonged use of PPE. Some people may have these skin diseases, and you can imagine when there is a heat from those, you see this PPE we use in the COVID cases. You may develop other kind of, first of all, you feel uncomfortable because of heat, and the heat stress is also another challenge, but also you may also experience some skin diseases, as well as it also increase the body temperature, as well as and sometimes the use of these gloves may cause aggravate existing hand eczema. As you see on this picture, when you use these gloves, you may have what we call it. So this is another exposure, because when we are dealing with these COVID cases, especially those who are working in isolation, they have to put two gloves, especially those who are in the isolation centers. When you go to disinfect, you have to put those gloves put the boots, everything, which may cause heat, but also which may cause another kind of disease like this, as you see on this picture. Psychological hazards. You see, when you are working in this, you can imagine those who are caring COVID patients, they may experience stigma, as I said before, worry about their health, their personal health, worry about the health of their family members, facing human suffering. Healthcare professional may work several hours. You can imagine people who are working in this isolation center or treatment centers, if they see they facing people dying every hour, maybe here we don't have a big number of deaths, okay, but you can imagine those are people who we used to see the report from Brazil, India, and so on, America. And you can imagine if you are a health professional and see 100 people die on a daily basis, or they are suffering a lot. So you feel those are kind of psychological hazard, and this affects healthcare professionals or healthcare workers. And also they have worry about their personal health. They have the worry about their family members, the health of their family members. Everyone here, you can imagine when you go home, you say, maybe I have an infection, I have COVID, you know. But also they may, these people, these healthcare workers, they used to work overtime. So when you work overtime or extra hours, you get tired. This also affects mentally, but also if you are tired, sometimes you may fail to perform other family, how can I call it, other tasks at home. People may understand what I'm saying. Okay. Now, healthcare workers can be exposed to infections in different ways. They are exposed, they can get infection through air, such as COVID, tuberculosis, measles. Those are kind of diseases or infections we can get through air. Remember recently, Dejo RBC was saying that when you give someone a lift, when you give someone a lift, and because maybe if he's COVID positive and you don't know, and he not even he doesn't use or he doesn't wear properly the mask, when he breathes, those droplets will be in the car, and when you remove your mask, and when you don't, or if you don't wear properly your mask, you will get the COVID-19, and you are exposed through the air. But also, healthcare workers may get infection through body fluids. Here we can say an example of HIV, AIDS, hepatitis, Ebola, and so on. People also may get infection through direct contact. This is why normally we are advised to keep social and physical distancing because of COVID. Because when you have contact with a patient or contaminated object, you may get COVID. This is why they say the government is promoting cashless, using by paying using Momo and other online payment instead of touching on money, because the money can be contaminated, and when you touch on it, you get infection. Shaking hands is also not is discouraged, because you may touch someone who is COVID-19, and automatically when you touch on him, you will get an infection. People also may get infection by vectors, but here there's no case of COVID where vectors that so far there's no research that shows that vectors may transmit COVID-19, but this is another way that healthcare workers may get other kind of infection. So infectious hazards are present in all healthcare facilities. Wherever you go, in healthcare facilities, as I said before, patients are there, non-patients are there, different clients, you don't know where they come from. So they may come with infection. Even those who we are treating in healthcare settings, they have infections. So in simple words, infectious hazards are present in the healthcare facilities. So we have to pay attention. So we are at risk. Healthcare workers are at risk. Therefore, they have to pay attention. All healthcare workers can be at risk, as I said, especially those involved in provision of direct healthcare to patients with infection, as I said before. Those who handle waste or healthcare waste or medical waste, they are also at risk than others. Those who are taking samples, lab scientists and lab technicians, they are at risk. Those who do contact tracing in the community, they are also at risk. However, not only the healthcare workers, actually those who are involved in those provision of direct healthcare or waste handling, but also these auxiliary staff, ambulance driver, cashier, they are also exposed. They are at any time get infection, COVID-19 infection. So they are not, we can't say they are not exposed. They're exposed, but the level of exposure is different from those involved in the provision of direct healthcare, those who are involved in healthcare waste handling, as well as those who are taking the samples and contact tracing, but they are also exposed to this COVID-19, as well as another type of infection. So people may get infection through body fluid pathogen. Literature shows that globally, there are at least 3 million accidental needle stick injuries. Even the study we conducted in Kigali, in the 3 district hospitals, actually the study was conducted in Muhima, Kibagabaga, and Kacyiru. Yes, and Kacyiru. We observed some number of injuries among healthcare workers, and those injuries was related to accidental needle stick. So we are healthcare workers are exposed to such kind of body fluid pathogen. Healthcare workers can be infected in several ways by direct contact with the blood and body fluids, as I said, needle stick, as well as these body fluids may even get to our ears or mouth when we are not properly use the masks. So this is another way that healthcare workers may get infection. Now, how can healthcare workers can protect from occupational hazard? Literature shows that healthcare workers should use all possible measures to protect themselves from respiratory infection. Those may include administrative control. So when we talk about administrative control, it means healthcare workers have to, for instance, managers, they have to set administrative control measures such as training healthcare workers so they can be aware on occupational risk that may occur managers, they have to put in place some policies and procedures, as well as like this COVID-19 screening. So I not screaming, but it's screening, not screaming, screening. They have also to establish and use protocol to control hazards. For instance, we in this context of COVID, if we may follow instructions like hand washing, and make sure they are working and so on. But also, there are also engineering control, such as safer medical devices, ventilation, modification of workplace. If, for instance, you know, in the context of COVID, you know, when you are working in a poor ventilation working environment, you are likely, if there's someone is COVID positive and you are in the same place which is not very ventilated, you are likely to get an infection. So in engineering control, we have sometimes, if the working place is not well ventilated, we may, there is a need of modification of workplace so that they can improve the ventilation. Even sometimes use of safer medical devices. I remember there's a time there's this robot at the international airport. The use of robot. So those are kind of engineering control, so that people in the workplace they may get infection. So to limit their exposure. There are also another way of controlling, which is called environmental control. Here we may say temperature sensor or smoke detector in working environment. So to limit people to be exposed to heat or any kind of fire, they may put in place smoke detector. If there is a fire, detector will know there is something wrong, and alarm will alarm, and people may get out. I used to see in different working place they put assembly point. I'm not sure if people, especially healthcare workers, they know the purpose of assembly point. But if they know, it's okay. But if they don't know, there is a need of trainings. I remember in 2018, I was in US, we had an exercise about this environmental control. They trained us about fire, but it was Friday. The next Friday, they put on the alarm, but very few people went out, which means they ignore the alarm, but you can imagine if it could be the real fire, what could happen? So people should get, they should not be able to exit the buildings. So we need to be aware on that. There also personal control, especially behavior of staff, including use of PPE. In some healthcare settings, people, even healthcare workers, they don't use properly the PPE for different reasons, either knowingly or unknowingly. So we need to, this is the way we can, if you don't use, this is how we are exposed ourselves. But if we use them properly, this is how we can protect from occupational hazards. We have also strictly follow IPC rules. IPC means stand for infection prevention and control. Especially those who are working in COVID treatment center and isolation, doing hand hygiene and so on. Those are some rules. They are guidelines that people have to follow in order to protect themselves from occupational hazards. Again, we have to protect from occupational hazard by keeping physical distancing from everyone at all the time, except once providing direct care to patient. Of course, if you are, for instance, taking a blood sample, you have automatically you have to touch on the patient, but you have to put on the protective equipments. At all the time, where possible, where applicable, we have to keep physical distancing to protect ourselves from occupational hazards. Again, it can be hard for healthcare workers to know whether the patient or object is in the working environment infected or contaminated. And this is why always have to be aware that we have to protect ourselves than being protected someone else. I'm responsible, you are responsible to use or to follow all standard precaution IPC rules in order to protect ourselves. So the standard procedures should be applied at all the time, like hand washing before and after all patient contacts. But we know you can even observe how many healthcare providers wash hands before and after having contact with the patient. Very few. I'm saying this because recently we said let's have an observation to see how people wash hands during this COVID pandemic. We said let's have an observation study to know how people wash their hands before going to restaurants. We put someone at the restaurant and we take a sample of 30 people. Only 6 people among 30 wash their hands. So you can imagine if I have an infection and I go to restaurant without washing hands, I touch on these spoons and plates, and you touch on them again. In other words, you get an infection. So this is why it will be hard to know whether the person or object are infected in the environment. Therefore, we have to follow these standard procedures. We have to use personal protective equipment properly, as well as use of disposal of sharps and sterile instruments and devices. Again, we have to conduct risk assessment in critical. We have to do the risk assessment to know where am I going. Am I going to work in the isolation? Am I going to work in the treatment center? Am I going to meet a patient maybe with COVID-19 or not? So this kind of assessment is vital, is very important. It will help you to determine the personal protective equipment that is needed for adequate protection. Because you can imagine if you go, okay, I'm going to meet patient and you don't put on mask properly, and the person you want to meet maybe is COVID-19. So in that case, you are exposed yourself. So you have to, healthcare professionals or healthcare workers have to do such kind of risk assessment before they perform any healthcare activity. That assessment will help to know what kind of PPE or what kind of protective measures I need so that I can protect myself. Hand hygiene. We have to wash hands before touching patient, after touching patient, after touching body fluids, and so on. Again, functioning hand hygiene facilities should be present for all healthcare workers. This is like if you are a manager or the head of healthcare facility and you don't have hand washing facilities, you are exposing your staff. So there is a need of need of functional hand hygiene facilities or hygiene and sanitation facilities in order to limit such exposure of patients as well as healthcare providers. There is a need of proper use of uniform. Healthcare workers should change in and out of the uniform because it will decrease the spread of infection from uniform worn in health facility to the family and community. On this point, I have to give you an example. Recently, it is in May. I don't remember exactly the date, but it was Friday. I was at Nyirangarama. Someone came with the ambulance with this green uniform. Those who are working in hospital, you know this green uniform. And the person entered the supermarket with the uniform. I was saying, this, you can imagine, this is a health profession. Okay, I did not judge him. Maybe, I said, because there was an ambulance, I said, maybe a patient ambulance maybe wants water or juice, I don't know. But I said, how comes that a healthcare profession, a healthcare provider with this uniform, hospital uniform, which normally has infection, go into the supermarket? At least the driver should go, if they wanted water or something else, the driver should go and buy the water or juice instead of healthcare worker with that kind of uniform. So healthcare worker should change into and out the hospital uniform. When they come to the hospital, to the healthcare facility, put on the uniform. When they go back, remove it. But if you can imagine at your workplace, people used to go to the restaurant with this tablier, this uniform, these shoes. You may see them. So we need to protect ourselves by using by proper use of hospital uniform. As well as we have to prevent stigma and violence against healthcare workers, and don't bring staff uniform or work clothes to wash at home. I don't have an example on this if people may take their work uniform to home for washing, but if it happens, this is also another way of exposing ourselves and exposing our families. So we need to be aware of that and limit if it is being happened. And if it is not being happened, we have to prep ourselves. There's also need of safe use of disinfectant, especially those who are working in IPC. There's a need of to know the proper preparation and use of disinfectant solution by following instructions written, as well as use of proper PPE when preparing and using disinfectant. Because if the disinfectant is not well proper, it will cause that chemical hazard that I mentioned before. Again, people should be trained to the proper use of PPE, because I remember recently I met students. Then I said, why some of them was wearing mask. It was like, how do we call umushanana? You see how umushanana is when you put umushanana, and it was really bad. And I said, why are you wearing a mask like that? Then they was, this man is used to do that. You see, and he's a future healthcare profession, because he's in the last year, and he's not properly wearing the mask, is he going to put on it properly when he will be in the hospital? If he doesn't put it currently, is he going to put it when he will be in the hospital? I doubt. So we have to be aware on that. Again, we have to buy disinfectant in recommended pharmacy. You can see, I used to see people buying, people who selling this disinfectant on the road, near the car park and somewhere else, on the sun like this. But I think, I may imagine, if the disinfectant from the morning up to the evening was on the sun, is it really a real disinfectant? I doubt. So people are encouraged to buy disinfectant in recommended pharmacy. Now, let's talk about the role of healthcare workers and managers in order to limit the hazards in workplace. Managers and employers have to organize necessary training on occupational health and safety. Again, managers have to identify and analyze the cause of hazardous incident. They have to consult workers on health and safety issues related to their work, avail the adequate protective equipment to all workers, develop preventive programs, as well as taking remedial action for reported cause of accident. This is the responsibility of employers. Some of us, we are employers, so we have to make sure that in order to limit or to limit occupational hazards and promote the safety of our healthcare professionals or healthcare workers in our healthcare settings, not only for COVID, but for the well-being of healthcare workers, we have to organize necessary training about occupational health and safety so that people can be aware of that. Again, you have to identify and analyze the cause of accident, as well as taking the remedial action for limiting occupational hazard and promoting the safety of workers. Healthcare facility should have a focal person for managing health and safety. I think in different healthcare settings, there's someone, especially I think those environmental professionals, it is their responsibility, in this context of limiting occupational hazards in the workplace. They have to carry out regular assessment of risk, organize such kind of training. I remember recently I was in the Ruhengeri Hospital. I saw they were organizing training on fire safety, such kind of. It was in the context of limiting healthcare workers to be exposed to fire. Healthcare workers, healthcare professionals also are responsible for following established occupational safety and procedures. This is the responsibility of healthcare workers. They have to avoid the exposure of others to health and safety risk. It may happen, for instance, if you use like this safety box and you use it, you are using it in proper way. In other words, you are exposing your colleagues to the occupational hazards. They have to participate in training organized by employers. You can imagine if there is a training on maybe IPC, infection prevention and control, and you don't attend, so you are putting on the risk. You are putting on the risk because once it happens, you will not be aware or you will not have sufficient knowledge and skills to limit the risk or the hazard. Healthcare workers have to report immediately to the supervisor any situation that may cause accident. So if you see there is a risk of an accident, maybe there is no proper use of PPE or any other kind of cause of accident or risk, and you keep silent, in that case, you are exposing your colleagues, even yourself you're exposing, because you don't know what may happen. If I get COVID-19, I may even infect you because you don't know. Healthcare workers, they have to assess their health condition or medical condition to know, for instance, if you have respiratory problems and maybe they say, okay, you go and work in the treatment center. So the COVID treatment center, so you are exposing yourself. So we have to know our medical condition, our health condition. So if you are eligible to carry out any health task. And if you are not eligible, you may communicate to your employer, to your manager, then they look for someone else. Of course, I can see how difficult it is, because in some healthcare settings, you may find there are little staff. This is another risk. Actually, the psychological risk. You remember I talked about the workload, the working many hours. So if you are in such case, you may have such kind of, if you are sick, you are not likely to work in such way, in such situation, but because of a little number of staff, you have to go. In that case, you will be exposed to that, to such kind of psychological hazard, as I mentioned before. So in summary, we have to avoid occupational hazard by following standard precautions, being trained in IPC, strict implementation of IPC procedures as it is written, follow all safety instructions, get vaccinated where applicable, report the risk before the hazard happens. Especially, you have to monitor the hazard in your environment. As well, report any occupational injury or illness, because you may say, there is risk, and you don't report. If you don't report, you're exposing yourself. So, but it's better to report the risk, the risk before the hazard happen. You have to report any occupational injury, what happened. If you, for instance, you have injection, which is not safe, you have to report, because it may be a source of disease, but also following instructions, especially this IPC, and as well as standard precaution, and get vaccinated where applicable. Briefly, this is what I have to say today. I thank you for your kind attention. Maybe we may start another session of questions. Thank you.
Thank you so much, Mr. Noel. It was really a nice session and so educative. We've looked at a number of things on how health workers can protect from occupational hazards. We saw behavior of staff, environmental control, physical distance, and so many other things. We saw risk assessment and what to do to avoid occupational hazards by following standard procedures. So I It was really a nice session. Hello? I did not see the participants sending in questions in the chat box. A few questions regarding the abbreviation. For example, there's a question on what does it mean PPE?
Yes.
You could tell us.
PPE stands for personal protective equipment.
All right, thank you so much. Then there's also another question on the abbreviation of HCWS.
Healthcare workers.
Right, thank you so much. So I think those were some of the questions. There are a few hands that were up, and I would welcome them at the end of the session, in order for not to cause interruption. So there's Grace Mutoni, if she's otherwise, please. Already there is confusion. So there's another question in the chat. What does donning and doffing mean?
Okay, thank you. Doing and donning, you see, those who are working in isolation in the treatment center, when they go, before entering in the center, where the patient are, they have to do something. And if they go out before, normally when you go to meet patient in the treatment center or isolation center, especially for those COVID patients, they say you have to put, first of all, you have to wash your hands, you have to put mask, you have to put those goggles, you have to put face shield, you have to put every, and you have to follow the steps as written. And if you finish, you go, maybe you meet the patient for, maybe you are going to know how he or she is, or you are going to give him medicine, or you are going to do something else. In that case, you have to follow those instructions. Then when you go out again, you have to follow instructions to remove all those PPE. In brief, donning is when you are putting all those PPE by following standard precaution. And when the doffing is when you are moving from the treatment center or isolation center, and you are removing those PPE. In that case, we call it doffing.
Thank you so much. For anyone that has a question, please put it down below in the chat box, or pick up your hand. I could welcome you, and then you could ask the question. So the other question, someone wanted to know what stigma is.
Okay. Stigma is like, you see, you feel stigmatized. It's like you feel it's like you feel ashamed. You have a sign of a shame, because you see, these people is working in isolation, is working with the COVID patient. You see, it's like, you see such kind of mark people may give you, and you feel ashamed because you are working in such environment. So psychologically, it will affect.
All right. I think stigma is like depreciating or discrimination based on different conditions, like Mr. Noel has said. So the other question, first I'll read a comment. This is very important. This is a very important presentation and it's good to be presented to everyone working at health facility. Yeah, thank you so much.
Thank you.
So the other question is not related to this topic, but it says, is there any relationship between curfew hours and COVID-19 infectivity? Maybe this is out of topic, but it's good to understand this as health providers. Yeah. Hello?
Yes, some institution put this COVID isolation between other departments. What could be your okay, I see the question. Actually, having isolation centers or isolation place, of course, you know, we have to know that first of all, before COVID-19, we don't know it will happen. We don't know, we do not have any information about COVID. But by the time it came, people try to make arrangements, and sometimes because of insufficient infrastructures, people try to adapt. So the important thing is, even if it may be different between departments, the important thing is to have to disinfect that place, not to limit people to have access. So we may have isolation center between departments, but we put the limits, the physical barriers to limit people to get the place. Even what you have, the isolation center you have at my workplace, it is there, but okay, somehow it is on other side, but people move, people have some movement around, but we put signs so to limit we put the physical barriers to tell people this is not accessible place. So we may have, because of insufficient infrastructures, you can imagine if you have COVID patient, and you have to put in the isolation and don't have a new building, so we have to use the resources we have. But of course, we have to limit access to those places by putting in place physical barriers.
All right. Another question here is that, my question is, in the health center, when you get a positive case with COVID-19, before examining the other patients, can we do, I think, dosing? That was the question.
Can you say again?
The question was, it is from Mukashema Lee Divine. The question is that in the health center, when we get a positive case with COVID-19, before examining the other patients, we can doping. I think they mean, can we do doping?
Okay. Of course, before, when you patient, you test the patient with the COVID positive. First of all, when he comes or she comes to his facility, you don't know if he's COVID positive. So actually, you know it when he come for, or she come the consultation room. You may see, he may tell you sign and symptom. Then you tell them to go to the lab for testing, and he may be positive or negative. But in that case, you did not know before. There is no need. There's no need of doing this donning, this PPE, because actually before he come or she come to you, you normally put this protective equipments. First of all, how you put them when you go to the consultation. To put this, we call it those tabria and mask and so on. So in that case, you don't need to put, but when you are going to work in the isolation, in the treatment center, of course you have to, because you know exactly that people are COVID-19 positive. They are positive cases, so you have to put on the PPE. You have to do doing, but in the consultation, because you don't know, if I come to you, you don't know if I'm positive or not. So there is no need, if I become positive, there is no need of putting, doing.
Okay, there's a comment about the speaker not being audible enough. I think maybe you could increase your volume. And then there's a comment, maybe people may express their question if possible. Yes, Mr. Nenzimana Umukunzi Clement, I already said if anyone has a question, they could put up their hands and then I could welcome them and they ask their question by speaking. So yes, I'm still waiting. The question here down below says, putting this isolation between departments can be considered as one way of exposing those attending these departments. Now, what could be your advice to overcome the challenge? Mr. Noel?
Yes, you said?
There's a question in the chat box, the last one, that says putting in isolation between departments may be considered as one way of exposing those attending that department. So what could be your advice to overcome that challenge?
I think I answered this question. I said because before COVID happens, we didn't know. And we know we have in some areas, in some healthcare settings, we have insufficient infrastructures, especially buildings. So they could not build they could not erect new buildings for COVID, because this, of course, it is costing. But where it happened to put isolation centers between departments, to me, what I can advise is that if it is not possible to relocate the isolation because of insufficient infrastructures, my advice is to put physical barriers to limit access of other people to access that place. So, and I gave an example. At my workplace, we have an isolation center, but nearby there are some offices, but we put some physical barriers to tell people this is not accessible place. So if it happened, they advised to put the physical barriers to limit people to access that place. Right?
Okay. I want to welcome Uitegetse Ernestine to unmute and ask their question. Yeah. Uitegetse Ernestine.
Is there any other question?
Yes, there's a question. Okay, Uitegetse, you can now ask your not muted.
Yes. Thank you for this presentation. My question is, when you go to some health facilities, they strictly use those preventive measures like PPE, and when you go to the others, they don't. I'm wondering, is this important for some health facilities, but not for the others. I'm asking, how can we adhere to use all those preventive measures everywhere where you can suspect patient? Thank you.
Okay, thank you, Occupational. As in my last three slides, I talked about the role of healthcare workers and managers to limit the occupational hazards in the workplace. Yes, it may happen, but this is really bad. I may say this is really bad because it may happen because of different reasons, but there's no reason of exposing people to risk like that. So, or it may happen because of negligence of healthcare workers. So in that case, it may be hard to say this is because of this. But the best way is to apply or to follow the standard procedures, the standard precaution as it is written in the guiding document. So if you remember, one of the risk, the hazard is behavior. Some healthcare professionals, some healthcare workers, they may neglect, may ignore to use of PPE, or even some employers may fail to avail those PPE. This is why I said the healthcare workers, they have a responsibility, but also the employers or managers of healthcare facilities, they have also responsibility. As healthcare providers, they have to follow occupational safety and procedures established. They have to avoid exposure of others to health and safety risk. They have to participate in organized training by employers. You may find people, you may imagine when there is training, but people do not attend. And when the situation happens, they will not be able to apply the appropriate knowledge and skills because they don't have such knowledge and skills. You know, when it comes to health, to managers, they may ignore, either they know or they don't know. So, but according to the standard precaution, they say they have to avail adequate protective equipment or workers. So you can't know what the cause of that unless you make an assessment and you know the real reason behind. Thank you.
Thank you so much. Nyong'u Fields, you can ask your question too. Nyong'u Fields.
What's the question?
The question is, he was wondering about the management of spreading COVID-19 by health workers, carriers.
Eh?
Hello?
Can you say again?
His question is, thank you very much for the presentation, but I am wondering about the management of spreading of COVID-19 by healthcare workers, carriers.
How many? Is it how many? Can she type the question so that I can see?
It is in the chat below. If you can read in the chat, it's there.
Is this how many hours?
No?
Which
Among
one?
the last, it's by Niyonkuru Fields Turatsinze.
I see the question from Fabienne.
Yes, then up.
I see Ntezimana.
And yes,
Niyonkuru. For the presenter, but I'm wondering about the management of spreading. Spreading of COVID by healthcare worry. Anyway, I think if I understand where her question is asking the management of spreading of COVID, spreading of COVID carriers. Anyway, the management of COVID spread among healthcare workers is not different from the way COVID is being managed, because if healthcare workers is tested positive, he or she has to be treated either by home-based care approach or by going to treatment center, where if he or she's the situation is aggravated, they have to be taken to treatment center. But if the situation is not worse, they have to be treated or follow or to be managed. Their case has to be managed depending on the home-based care approach. I'm not sure if answer her question, but their management is following the national guideline. There is no I think there is no special guideline for healthcare workers for treatment, but the national guideline is applied to all.
Okay, thank you so much. There's a question on how many hours should the face mask be worn and then changed?
Okay, actually, normally the use of mask and the time of changing it may also depend the type of mask. First of all, we know we have different type of masks, but normal we have to. First of all, we have this cloth mask and surgical mask, and when we are using this mask, we have to change them. Actually, they depend on the WHO recommendations. They say at least we have to change the mask twice a day. But for depend on the way you are working. For instance, if you go to a treatment center or you are working in a treatment center, or you are going to meet patient in isolation, you put on the mask. When you are doofing, you will remove the mask. When you go back to meet again another patient, you put on the mask. So this will depend on the working environment, but normal WHO says the mask should be changed twice, but this will depend on the working place. For instance, if I'm not in the treatment center, on the isolation center, I may use the mask and change it twice. But if I'm going to meet patient, when I do doing, I have to put the mask. When I will do doofing, I remove it and put the waste dustbin. And when I go back to meet another patient, I have to do some disinfection. I have also to put again another mask. This may depend. Hello?
Yeah. All right. Thank you so much. Thank you everyone for participating, engaging in the comment section by asking to our facilitator and also giving in some comments on where, on helping out. Thank you so much also for attending. I would like to thank Mr. Noel. Thank you so much for the good presentation and explanations and the questions answered. It was a really educative session. Before we leave, I would like to ask all participants not to leave the room without getting the link to access materials. There are so many questions on getting the PowerPoint presentation, and also those with questions on how you get certificates. There will be an evaluation, which will all be on the Health-Edu platform. So please check in the comments section in the chat box. You'll be able to see the link. It's going to be sent and has already been sent a number of times. Please click there and then you'll be able to answer the evaluation for you to be able to get the certificates and also to get the reading materials that have been presented. Thank you so much for attending, and also thank you so much, Mr. Noel, for the good presentation. We are really grateful.
Okay, thank you, Anne, for organizing this session, and your team, Agnes, Gamb, and others. Also, thanks the participants for your kind attention and questions. It is really very important to meet you, and I'm really very happy for you. Thank you.
Yeah, thank you so much. There is a bunch of thank you in the chat box below. I think Mr. Noel, you'll be able to see them. The participants were really grateful. Thank you so much, everyone. I think we can now leave.
Bye-bye. Thank you.
Bye.
Thank you.
Bye. Thank you.
Bye. Thank you.
Bye.
Nice.
Bye. Bye.
Bye. Bye.
Thank you so much.
Thank you. Thank you.
Thank you.
Thank you, everyone.
See you next time.
Yes,
See
you are
you.
welcome.